We got like 3
hey guys,
viewers. Say
we're just trying to
hi.
get our Facebook live feed running. I think we are having some
Live on
success,
Instagram.
but hey, at least we're live on Instagram. I love Instagram. I encourage everybody to, besides this video that we're going to have today as a live version, but we're also going to have it recorded and posted later. But please follow me on Dr. Roy Los Gatos, at Dr. Roy Los Gatos. I have lots of really fun information about procedures I do, as well as befores and afters in really fun formats. So I really hope that it's useful to you guys, that it's fun, it's entertaining, but it also teaches you something about what I do and the patients that come through our office and get these awesome results. So we're going to get started. Audrey has a set of questions that were submitted by people on social media, and I'll do my best to answer them in a very short but concise format. So let's go with the first question. First question, all right. What does it mean to be a board-certified facial plastic surgeon? Okay, so that's a good question. There's a lot of different board certifications, a lot of people out there doing both non-surgical cosmetic interventions as well as cosmetic surgery. For facial plastic surgeons, the vast majority do a residency, after medical school, do a residency in otolaryngology head and neck surgery. It's a 5-year, pretty intense surgical program that entails all facets of surgery related to the head and neck. So as you can tell, lots of expertise, both functionally and cosmetically, as far as this general anatomical area. The majority of those people who are interested in the facial plastic and reconstructive component of head and neck surgery end up doing a fellowship program through the American Academy of Facial Plastic and Reconstructive Surgery, such as the one that I did. And that's usually a very, very rigorous 1-year program in any facet of facial plastic surgery that you're really most interested in, whether that be rhinoplasty, aging face, reconstruction, or a combination of the different things. In my particular case, I did an aging face and rhinoplasty fellowship with a private practice in Austin, Texas, and that was a 1-year long course. After that, you get board certification in otolaryngology head and neck surgery. So most facial plastic surgeons are board certified by the American Board of Otolaryngology Head and Neck Surgery. Subsequently, some of us also go on to doing a double board certification through the American Board of Facial Plastic and Reconstructive Surgery. So, again, when you're doing your research and you're looking for a facial plastic surgeon, make sure that they're board certified, at least in otolaryngology head and neck surgery, and that they've completed a fellowship in facial plastic and reconstructive surgery. Okay, next question. Where are the procedures performed? In office, hospital. So where am I doing all these procedures? Okay, so it kind of depends on what kind of procedures we do. There's actually a fair amount of cases that we are able to do in the office. That being said, I have a procedure room here in the office. It's a sterile environment. It's a large environment. It's got everything that I need to do any surgical procedure that you can think of. But mostly, we're talking about shorter procedures, ones that I don't anticipate, any significant bleeding, that kind of thing. So, common things that are performed in the office are upper blepharoplasty procedures, on occasion lower blepharoplasty procedures, any ear pitting surgeries like otoplasties. You can do lip lift procedures. You can do mini facelifts, and that's actually one of the more popular things that I do here in the office. And we can go into that in a little bit more detail in subsequent questions. And a lot of chin implantation, neck lifts in younger people, as well as something called a Renuvion neck lift, which is a combination of doing a neck lift with skin tightening using an awesome technology we have here called the Renuvion, which is a subdermal radiofrequency tightening procedure. Other procedures that entail, longer cases like full lower facelifts, or ones that are combining multiple procedures like eyelids, fat transfer, chemical peels, facelifts, tends to be a little bit longer, a little harder to do here in the office. I actually take patients to a private surgical center. It's owned by another plastic surgeon. It's really just me and 2 other plastic surgeons that operate this place, very private, very intimate. And there we can actually do procedures under what we call IV sedation, which is kind of like the sedation you get during a colonoscopy. IV in, medication in, you're asleep, but you're breathing on your own, no tubes. Although general anesthesia can also be used, and that is particularly the case in rhinoplasty procedures. So I hope that kind of gives you a sense of where I operate and what kind of anesthesia is involved. All right, number 3, product recommendations for before and after procedures. Okay, so another good question. This is a very evolving subject. We are always striving to give our patients the best possible outcomes. And oftentimes it's not just the surgery that does the trick. I oftentimes in consultations will talk to patients about, addressing three major components. Not just gravity, which is where the lifting comes from, not just volume, which is, things like fillers and fat transfers, but also skin. You need really, really good quality skin to get the best possible outcome from any facial plastic surgery. So to that effect, yeah, I work with amazing board-certified dermatologists that help most of my patients get through their skin journey, and they allow them to have the best possible outcomes before and after surgery. But just for my own recommendations, I really like a skincare line called Elastin. Elastin is a medical grade skincare company that essentially allows us to help restore and give more collagen and elastin in people's skin before and after surgery. So what I usually do is I use this product. This is a duo kit, but in this kit you'll see there's something called Regenerative Skin Nectar. I use this product on every lower facelift, chemical peel, fat transfer patient that I do, even sometimes on eyelids. I'll have them use it for 2 weeks before, twice a day, and also for about 10 days later. After that point, I go to the Restorative Skin Complex, which is almost like a moisturizing cream when they're ready to be able to use that. This is better for like just immediately post-surgical, and for pre-surgical planning, this is for later. And again, as I said, I've found just with the use of these two products that people's skin just tend to heal. Occasionally, I'll use the Elastin Soothe and Protect Recovery Balm for chemical peel patients instead of Aquaphor, and I think they're let my dermatology colleagues do most of the skincare talk, but I really, really like these two products for sort of long-term rejuvenation for my patients, both before and after, but definitely after. I recommend the Definage 8-in-1 Serum. It's, I think, the best anti-aging serum that we have. It's almost like 8 times as powerful as any other serum that I know. So I love this one, and I recommend it wholeheartedly. And then something to combat, solar damage, solar elastosis, which is a vitamin C, like an antioxidant vitamin C serum. And I really like the one from Revision. So these are two things that I use oftentimes on patients after surgery. And then finally, scar gels. We spend a lot of time and effort trying to make sure that incisional healing is perfect or as good as it comes. But occasionally, you'll want to give patients a tool to do themselves at home to help the maturation of a scar. And I use Stratoderm is my sort of go-to. It's a very pure silicone based scar gel. It works most of the time. If I have someone who's a little darker skin type that pigments quite a bit after incisions, I'll use Skinuva. This was developed by an oculoplastic surgeon, a good friend of mine, Christopher Zumelin, and I think it works really, really well for post-surgical scar maturation as well as for hyperpigmentation from post-inflammatory hyperpigmentation. I hope that answered the question. All right. Do you recommend facial plastic surgery for anyone under the age of 18? So that's a good question. Just yesterday, I saw 2 patients that were 18 or below. These were for rhinoplasty cases. So, it's a bit of a... It kind of depends, I guess. So when we're talking about rhinoplasty procedures, I think that it's pretty safe to get any sort of nasal reshaping or functional nasal work done anywhere past the age of 15 and 16. And so I've definitely operated on patients at that point. I think that their nose is pretty much done with the developmental cycle. You can argue that up to 20, 25, the nose keeps on changing just a little bit, but those changes are very incremental. So I think that it's very safe for patients to go through rhinoplasty procedures anywhere above age 15, 16. Of course, parents or guardians would need to be involved at that point for consent and permission and for just overall support during before and after the procedures. Other things that are commonly performed for patients under the age of 18 are submentoplasty, so double chin surgery, chin augmentation, as well as ear pinning procedures. Ear pinning procedures can actually be performed for kids anywhere above the age of 5 or 6, because by that time your ear is fully matured. So otoplasty is the thing that I do for the youngest kids, but generally I see patients from like their 15, age 15 to about 18 for submentoplasty, which is double chin surgery, chin augmentations, potentially even lip lifts, but mostly rhinoplasty. All right, what is the recovery for a rhinoplasty? Okay, so again, kind of variable. It depends on your approach and also what you have to do or what you end up doing. Generally speaking, with an open rhinoplasty, which is what I do most of the time, and that just means a small incision on this part of the nose. You kind of open up the nose almost like a hood of a car, and you just do whatever you need to do and put it all back. Because of that additional dissection, there is a little bit of swelling and bruising associated with that process, but it's still not as bad as most people think. I have a splint and sutures that stay on for about a week. Once the splint and sutures come out, I would say that the vast majority of patients are fairly social. If any osteotomies or very precise breaking of the nasal bones need to be done, either for a crooked nose or to bring in, the width of a nose, that seems to be the one thing that will cause a little bit of bruising underneath each eye. That could last anywhere between 7 to 10 days, maybe a little bit longer than that. But if you don't need osteotomies, but even if you get osteotomies, I would say your social recovery is close to about 10 days. You might feel like you have a bit of a stuffy nose for about a week, and that's totally normal. Most of the swelling starts off on the inside, and once the splint comes off, you'll get a little bit of swelling on the outside. But I would say probably somewhere around 10 days. Which procedure do you perform the most? So, as a facial plastic surgeon, and I think this may be another question coming up, but 100% of what I do is facial plastic surgery. So it's not like I'm doing, breast work, body work, and then, a few facial plastic surgery cases. 100% of what I do, every case I do is a facial plastic surgery case. That being said, the most commonly performed procedure that I do is probably upper blepharoplasty surgery, which is upper eyelid surgery, essentially removing redundant skin or fat from the upper eyelid. It takes about an hour to do. It can do it here in the office under local and minimal oral sedation, if that. And so that seems to be the most popular. I also do a lot of mini facelifts and lower facelifts, which is lower facial rejuvenation, okay, for the jowls, jawline, and neck. That's, I would say, one of the things that I really like and enjoy doing, and it seems to be a really, really big part of my practice. Part of that being the fact that I'm part of a multi-specialty cosmetic practice, which involves dermatologists that do a lot of the aging spectrum prior to surgery. So I get a lot of referrals that way. And then the third most common thing that I probably do is rhinoplasty surgery. Again, that's a passion of mine. That's why I went into facial plastic surgery in the first place. I was really the only one in my resident class that always gravitated towards rhinoplasty cases. Everybody else was like, oh, you can have it. And I'd gladly take it. And I love those cases, and I still enjoy doing them. So that would be like probably the third most popular.
We have a viewer question. At what age should people get facelifts?
That's a great question. The way that we do facelifting procedures today is very different than the way that people used to do them, maybe even 10, 20 years ago. The common understanding or the common misconception is that, okay, well, I have a lot of patients, I'm not ready for a facelift yet. Things haven't gotten that bad yet. And so everyone assumes that it's, in your 60s, 70s, 80s. But I'll say that the vast majority of my patients that come in for lower facial rejuvenation from a surgical standpoint come in their 40s and 50s, okay? I've even had patients that I've done mini lift procedures on in their 30s, late 30s. And the reason for that is that ultimately, you don't want a surgical procedure to completely change the way that you look. You don't want a huge abrupt change. So in my opinion, good facial plastic surgery is natural, is subtle. People won't necessarily be like, oh my God, what did she get? She just looks better. He just looks better. And they can't put a word to it. And at some point, we're going to comment on a few celebs out there that people are talking about as far as whether they got any sort of surgery or not. But generally speaking, good plastic surgery, you shouldn't really be able to notice, but the person notices. The person just really exudes confidence. And so I would say that the vast majority of my patients that come in for mini facelifts are coming in their 40s and 50s. There's a statistic out there that you can read on Google. I don't know how they came up with this number, but the average number of facelifts in a lifetime is 3. So if you can imagine that, you're getting 3 facelifts in a lifetime. And so know that just because you got one in your 40s or 50s, you can always get another one subsequently. It's always better to go to the surgeon that did your original one because of the knowledge of the anatomy and what was done. But I see a lot of revision facelift patients second, third time arounders. So I hope that answered the question. Which facial plastic surgery procedures typically need a touch-up or revision after time? So That's a good question. You know, a lot of people talk about facial plastic surgery or just plastic surgery in general as a one and done procedure, right? I mean, you know, you spend a lot of money on things that are non-surgical, injectables, fillers, thread lifts, and that kind of stuff. And some people are just kind of sick and tired of that, or they just want something that's a little bit more definitive, a little bit more long term. I will say that no procedures that I perform is a one and done thing. That being said, you know, if you undergo a lower facelift and you look 10, 15, 20 years younger, and then you age 10, 15 years, or the facelift lasts about 10 years, it's a huge improvement. Even though you've, you know, aged 10 years, you still look 10, 15 years younger. So I'll say that, you know, there isn't any particular case that I can think of that requires frequent touch-ups. Know that a lot of people get upper eyelids done or upper blepharoplasty, upper eyelid lifts done very, very early on, usually 30s, 40s, 50s. And I see that, you know, people who are, especially who have a little bit more sun exposure, maybe genetically they have more skin laxity, they tend to see some of this stuff come back. Some of that crepey skin start coming back. Some of the little, you know, crepey lines around the lower jowl area coming back. And that's why it's so, so important. And I am blessed to be, you know, in this practice with these board-certified dermatologists. They can help maintain and preserve the results of my facelifting through heat-based devices, great skincare, as well as volume. So I'd say that, you know, there isn't anything in particular that requires frequent revisions, but anything over time can potentially recur. So always keep that in mind. Where are the incisions made for an upper blepharoplasty? Okay, so pretty simple. Upper blepharoplasty incision is placed right within the eyelid crease, okay? That's why it's probably one of the more popular procedures performed by any aesthetic providers or plastic surgeons, because you know, a lot of people are aware that ultimately the incisions are very, very well hidden. It doesn't take very long to do. The one caveat to that is that although most of the incision is hidden within that upper eyelid crease, there is a small little extension of the upper eyelid incision that kind of extends laterally this way to be able to catch some of this, what we call lateral hooding. So, you know, when the brow falls a little bit, you get a little bit of hooding on the lateral aspect of that. That, unfortunately, the eyelid crease does not extend all the way there. Oftentimes, we'll find a little crease, though, natural crow's feet crease to put that little extension in. But again, as I said, once this is all healed, 3 weeks, 6 weeks, sometimes, you know, if you give it a little bit longer, it gets even better. No one's going to be able to tell that you had an incision there. It gets so difficult to be able to tell. How do I know if it's time to have plastic surgery? When you're looking in the mirror and you're like, if only I could just do this. That's like the most popular reaction I get in consults. It's like, you know, I'm looking in the mirror and if I could only just do this. I'm like, well, I can do that, and I can do that really easily. So it just depends. A lot of people, especially nowadays, are starting to do things like neuromodulators, Botox, Dysport, Xeomin, that kind of thing, early on to try to prevent the formation of deep set wrinkles in the face, you know. So there is a lot more emphasis, information out there. A lot of people really admire, like actresses, actors, singers, you know, what give social media personalities. They're all starting to do this stuff really, really early on, and so I think a lot of people have followed suit. So, with that being said, a lot of people are doing Botox, fillers, they're doing heat-based devices to help tighten skin. So ultimately, I think, you know, people are looking for less invasive ways of just improving and refreshing their look without the downtime that some people assume comes with plastic surgery. That being said, there is a time when all that stuff maxes out. It either becomes really unnatural looking. Everybody knows about duck lips. Everybody knows about filler facelifts gone wrong, too much volume. So at some point you'll reach a point where the things that you're doing non-surgically just can't cut it. They don't cut it. They're not really resulting in the kind of definition and outcomes that you're looking for. And I think that's when you know you may be ready to talk to a facial plastic surgeon or a board-certified oculoplastic surgeon or plastic surgeon about plastic surgery. Last question. I can't believe it. What makes someone a good candidate for facial plastic surgery? Okay, well, I'll say that on the whole, it kind of depends. So let's just talk about it. I'm going to focus more on aesthetic facial plastic surgery, cosmetic facial plastic surgery, because there's a lot of functional plastic surgery, reconstructive surgery that is done by a lot of great colleagues of mine. I don't do very much of that stuff anymore, but for aesthetic cosmetic facial plastic surgery, who's a good candidate? Generally, people are healthy. Generally, people are compliant, or they understand that it's important to listen to instructions, take medications as indicated. They're people who don't have any bleeding disorders or are on medications that potentially put you at a higher risk of bleeding. That being said, on occasion you will get patients that are on medications such as aspirin, Plavix, Xarelto because of some medical condition. And I won't say that that's an absolute contraindication to getting facial plastic surgery, but myself or the plastic surgeon needs to talk with your medical doctor, figure out what we can do to try and hold some of these medications for a certain period of time before and after, so that the actual surgery can be performed without major complications, and I'm particularly alluding to bleeding complications such as hematoma formation. So, that kind of thing. There are also some certain skin conditions that don't allow for a good healing result after surgery. And so, it's very, very important. It's very critical to sit down with your doc, have a full-on consultation, talk about your, medical history, your physical, your past surgical history, any allergies that you might have, and also any family history that might be relevant. And then finally, I just say, just to put it out there, there's still, a fair amount of people who use tobacco and cigarettes and smoke. And so I'll say that certainly affects your healing outcomes. And with very delicate procedures like facelifting procedures where you're really, really depending on good vascular supply to the skin, smokers tend to have a much, much higher risk of healing complications and skin complications after surgery. So I usually, at the very least, 2 to 3 weeks, complete cessation before and after. That seems to be reasonable for a reasonable healing result. But of course, complete cessation, stop smoking. That's the best advice I can give. So I think that's it. Any other questions, Audrey, that have come up during the live stream? If not, that's okay. Know that I'm always open to answering your questions. Instagram, Facebook, just DM me, comment. Please follow me at Dr. Roy Los Gatos. I think it's going to be really, really fun. You can see a lot of befores and afters. I explain a lot of the procedures that I do, including anything before surgery, recovery. I'll also show you, if you feel like you got the courage for it, some parts of the actual procedure too, so you can kind of see what you might be getting into. And also there's just, it's really fun to be able to see what other people who have undergone this procedure look like, before and after, what their recovery is. Sometimes I'll even post what 1 day after surgery looks like, or 1 week after surgery looks like. We also have so many amazing patients who are willing to talk to you if you'd like to get an opinion of someone who's gone through the process. So what is it like? What is Dr. Roy like? What is Christine, who's my patient care coordinator, like? How is the process? Is it, as seamless as he makes it seem to be? So all these things really important, and know that we have those resources for you. But again, I hope you found this useful. I think we are just on time. Great questions. Thank you so much. And I hope to be able to do something like this soon enough with a whole set of new questions. So thanks for joining us. Thanks for tuning in. We'll record this session and we'll post it later on for anybody who missed it. Till then, have a great day.